Hi, everybody. First of all, thank you for the opportunity to be here and I guess talk about modeling, which of course is something I'm passionate about and something that I believe that has a lot to contribute to the discussions about the health implications of e-cigarettes. I did have slides, but I decided not to show them. We've done a model, and some of you may have already seen that. It's an analysis that we did to look at the effects of that e-cigs might have on adult smoking prevalence, depending on what they do to smoking initiation versus what they would do to smoking cessation. That was published in Epidemiology. Sarah Chern is the first author. And basically what we found there is that given the current context of who is using e-cigs, predominantly current smokers, right? We saw this morning. And also, given where cessation rates are and initiation rates are right now in the US, is that given that right now, the effects on cessation would outweigh potentially any effects on initiation, right? That smoking prevalence would be more sensitive to whatever e-cigs do to cessation outcomes versus what they would do to initiation, right? And that was the main conclusion. And of course, right now the big question is what are those effects, right? Are e-cigs going to increase cessation? Are they going to decrease cessation? And are they going to act as a gateway or not? So the thing that we were told that today the discussion was going to be about what are potential applications of modeling in the e-cigs debate, and what are some of the data gaps or needs or uncertainties that we have when building these models. So I just wanted to basically maybe summarize a little bit of what has been already said and then give my perspective on that. So as we saw today, so in terms of the uses of modeling or applications of modeling, so we saw that one of the main ones is to project what's going to be the impact, right? Under certain assumptions, maybe right now more of what-if scenarios, but looking at what would be the effects long-term, maybe looking at long-term cohorts of what are they going to do, right? Are they going to increase smoking or decrease it? And then are they going to increase smoking-related mortality or not, or tobacco-related mortality as well? One important thing is that what I mentioned in terms of the trade-offs, right? It's not going to be a simple thing. Probably they're going to have an effect, hopefully positive in cessation. They might actually have an effect on increasing initiation. And the question is, what are the trade-offs? And that's something that modeling will be good to actually look at. One thing that was mentioned earlier is a little bit of what are the individual behaviors, the individual effects and behavior on population outcomes, right? And so talking about direct effects on helping someone quit or pushing a kid to try e-cigs and then smoking versus indirect effects, right? And modeling is a great way of looking at those and then putting everything together and getting an outcome. Of course, project the short and long-term impact of policies. And that's a very important piece because likely what happens with e-cigs and their health effects is going to largely depend on the regulatory environment, right? And depending on the policies that are implemented, there is the possibility that we might push whatever the outcomes were going to be to a more positive rather than a more negative place, right? So how can we identify the optimal combination of policies? That's something that modeling will have to be used, right? Because otherwise, how do you do it? Another thing that's been mentioned is the interaction between new and old products. And that's something where, as we're moving forward, new types of e-cigs are coming, new types of tobacco products are coming. And then these type of models where Eric showed one where he had like 2 products and 9 transitions, right? He said, if I put 3 products, then it's going to get all crazy. But that's where we're going to have to go. And if you have to make decisions based just on reading the literature, well, good luck. But it's going to be really hard. So some of the biggest uncertainties, and it's been clear through all these talks, and the talk earlier by British American Tobacco, right, where they did a population model, and David Mendes asked the question, why did you assume 5% of excess relative risk or relative risk relative to cigarettes, right? David Levy also mentioned this was our range. And that's the biggest uncertainty right now. whatever, there have been modeling studies that have assumed higher relative risks of e-cigs, so being about 50% of cigarettes. That's up to debate and, of course, up to people to evaluate the evidence and decide. But basically, narrowing down that value where it might be, it's critical for these models that we're using and proposing to actually provide estimates that are more reliable. Patterns of use, that's critical. We need to know what are the patterns of use. This morning, we saw predominantly current smokers, former smokers. That has big implications. Knowing that really well will be really important to actually help us, modelers, parameterize our models and calibrate our models to the right way. The effects on smoking initiation and cessation, that's critical. What are they going to do? Are they going to increase initiation at the population level? Are they going to increase or decrease cessation at the population level? With cessation is an important distinction is that we probably need to know this from a context or knowing the effects of cessation and smoking, knowing the effects of e-cigarettes and smoking cessation, depending on if it's a smoker who actually wants to quit versus just like an average smoker, right? And that's going to be critical. Finally, one thing that we haven't talked much about, but a big question that I have is what is going to be the effects of policies on e-cigs use, right? We know what taxes are going to do, let's say, with smoking behavior. We know what other policies are going to do with smoking. What are they going to do with e-cigarettes? Today, we saw that e-cigarettes users are a very specific subset of current smokers, of former smokers. So we cannot expect that the policies are going to just actually act in a similar fashion. So in terms of, that's probably going to be more long-term, but one of the big uncertainties that we're going to have as modelers is what do I put as the effect of a tax, differential tax, let's say, on cigarettes versus e-cigarettes in my models, right? And what do I assume about that? Finally, and as I was taking notes, one of the things that came to mind today was like the huge heterogeneity that we have in the e-cigarette market, 8,000 products, whatever the number of products they are. And that's something that brings the question is, what is that going to do? What is that heterogeneity in product availability, in liquids, in their effects potentially is going to have? And that's something else where modeling might be able to have an important contribution in trying to understand what is that heterogeneity going to do to the health outcomes of e-cigarettes in the long term. So I'll stop.